Good afternoon. My name is Louis DeMello, and I am the CEO of Sinai Health Foundation. Our board chair and committed champion, Maxine Granowski-Gluskin, is unable to be with us today, but she expresses the importance of this discussion and thanks you all for joining. It is my honor to participate as moderator for today's event alongside an incredible group of individuals who you will hear from as we discuss this critical issue. At first, would like, though, to take a moment to acknowledge the land we are meeting on, that it is a traditional territory of many First Nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, the Wendat peoples. The land is now home to many diverse First Nations, Inuit, and Métis. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. Today's discussion is meant to shine a light on the important topic of women's health. For this demographic, healthcare is often underrepresented, underfunded, and underserved. There also exist systemic barriers and stigmas that can lead to people suffering unnecessarily. By coming together today, we hope to build awareness of this issue and inspire future conversation and support of women's health. Sinai Health is home to the largest women's health program in the country, providing leading-edge care to women of all ages and stages of life. Each year, thousands of expecting and new mothers walk through our doors, and more than 1,200 patients are supported on an annual basis by our mature women's health program. We are committed to advancing women's health, but we cannot do it alone. This is why we are so grateful for WCM's support and partnership in today's event, and also to all of you for taking part in this afternoon's important conversation. And this is the beginning of many conversations to come. This hour, you will hear from many great speakers. It will be followed by a Q&A discussion where they will answer your questions. But to kick us off, it is really my honor and privilege to introduce Lara Zink on behalf of our co-host, WCM, for some opening remarks. Lara?
Thank you, Louis. We're thrilled to be here today. At WCM, our mission is to accelerate equity, diversity, and inclusion in the finance sector. To execute this mission, we focus our work around three core pillars: building equity literacy through research, thought leadership, and advocacy, amplifying diverse talent and accelerating careers, and lastly, uniting the industry. We partnered with Sinai Health Foundation to discuss women's health and the bias and barriers that exist around it. Bias is not a new area of focus for us. WCM focuses on research and resources that help our sponsor organizations and members implement efforts to combat bias. Yet, bias still persists in overt and subtle ways in our workplaces and creates significant negative effects on career progression. Our research and advocacy will continue on this very important topic and has led us to today's event. We're very pleased to partner with Mount Sinai Health Foundation and looking inside at biases and barriers as women face in the health system. Over the next hour, we hope to advance our collective knowledge on these topics and learn how Sinai Health Foundation is evolving our traditional approach to women's health to meet the needs of women. I'm pleased now to introduce Joanna Rottenberg, who wishes she could join us live, but was gracious enough to record a video message for today. Joanna is the president of personal investing at Fidelity Investments and also serves on the Sinai Health Board of Directors.
I'm excited and privileged to be given the opportunity to introduce this discussion. A big thank you to Sinai Health Foundation and WCM for bringing us together and for supporting such an important mission to further health equity for women. I know this is going to be an engaging and inspiring conversation that highlights the great work Sinai Health is doing around women's health equity and reducing stigmas associated with providing female-centered healthcare, especially for a mature population. I'd like to share a little bit about why this is such an important topic and conversation for me, both personally and professionally. Professionally, I've always been fortunate to work at several leading organizations in my career. And though the work itself has varied, I've always been motivated to work towards removing barriers and increasing accessibility for women, primarily in financial services. For me today, that means constantly looking for ways to empower and enable women to grow their wealth. And it's about deeply understanding the unique needs of women, all kinds of women, and delivering female-focused solutions and experiences that meet those unique needs. I believe, and there's plenty of evidence that supports this, that wealth and health are deeply intertwined. It's hard to have one and not the other. And increasing one often boosts the other. And that's why I am so inspired by the work Sinai Health is doing in this area. Now, on the personal side, I'm in the target demographic. And the breakthroughs that Sinai Health are going to be driving by advancing work focused on women will benefit me personally. I know there's sometimes some taboo about talking about female-centered healthcare, and I'd like it to not be that way for others, and especially not for that next generation. I'm proud to be a part of the Sinai community and the WCM community who are driving change for women, both in health and wealth. And I look forward to continuing this important conversation with you all.
Thank you very much, Lara and WCM and Joanna, for joining us today and for your wonderful support of this event. I am now pleased to introduce our first panelist for today's discussion, Dr. Lindsay Sheriff. Dr. Sheriff.
Hi, thank you very much for having me to speak on the panel today. My name is Lindsay Sheriff. I have been on staff at Mount Sinai Hospital as an obstetrician and gynecologist since 2015. I started after completing my residency at the University of Toronto, and I completed fellowships in mature women's health and menopause and in minimally invasive gynecologic surgery and a master's in quality improvement and patient safety. And what makes our site so unique and what drew me to a career at this hospital is the ability that we have to provide very outstanding, high quality care to people at all life stages. Within the Department of Obstetrics and Gynecology, we offer a broad range of services to patients, from our reproductive endocrinology unit, where patients seek assistance with fertility-related challenges, to our large group of very talented obstetrical care providers with very niche and subspecialty clinical interests, as well as those offices that follow low-risk pregnancies like myself, to the robust gynecology service that has a large group of gynecologists offering surgical and non-surgical care to women for a variety of different gynecologic complaints, such as fibroids, endometriosis, vulvar conditions, cancer and precancer conditions, as well as the mature women's health and menopause unit that Dr. Wendy Wolfman has really spent her life building. And she has created this wonderful unit that we now operate as a team. We see women in this unit with very debilitating symptoms of perimenopause and menopause. And we also provide very important care to younger women, such as those suffering from premature ovarian insufficiency. This is 1% of all women. We provide care to those experiencing menopausal symptoms as a result of menopause that happened because of cancer treatments. And we also provide care to women who are known to have genes that will render them menopausal after they have surgery. And they're having surgery because they are trying to reduce their risk of future cancers. And this is work that Michelle Jacobson has really championed at Women's College Hospital. But this is the clinical piece of what we do in obstetrics and gynecology. And what you may not be aware of is the academic and the research work that happens here. This is an organization that encourages and fosters physicians and medical researchers to hone their academic and research pursuits to improve patient care. And in my case, it's improving the care of women. For me, my passion lies in quality improvement and patient safety, and I've been able to publish and create a research program around quality improvement. And what may be of interest to the audience today is the recent launch of the Gynecology Quality Improvement Collaboration. It's a website that you can look up, www.gynqi.com. It's an extension of a 10 hospital, 4 university program that we started right here at Sinai that gives scorecards to GYN surgeons across the country that lets them reflect on their performance metrics for this very commonly performed surgery that women receive. And we started this here at Sinai. But what we found was that there was a huge lack of access to very good patient-facing resources. And so this audience may find it helpful to go into our For Patient section on the website. We've created 45 amazing patient-facing handouts that give you very high-quality levels of information. And there's a section on menopause. And that may be where you start to look at what you're potentially experiencing for some of your symptoms or your friends or your family. But we're looking forward to expanding this over time. Last, I was asked to touch briefly on the barriers, and we're going to talk about them later in the session, that women may experience in seeking healthcare. And I think the biggest things that, I think it's the lack of accessible patient-facing information, and also women spend a large majority of their lives in so many different roles. We are mothers, we are grandmothers, we are also professionals, and sometimes it's very hard to look at some of the symptoms that we're experiencing and to seek care because we're so worried about all these other aspects in our lives. And so I think that that's one of the barriers that women do face. Certainly, but here at Sinai and in the Department of Obstetrics and Gynecology and the Mature Women's Health and Menopause program, we're looking to make care more accessible to patients, and we hope that we're doing this through clinical and research endeavors. Thank you.
Thank you very much, Dr. Sheriff. Thank you. The work you do and your colleagues is truly remarkable, and it is very much appreciated. So thank you so much. I am now really thrilled to introduce a trailblazer in this field and this work really that has shaped where we are today, and that is Dr. Wendy Wolfman. So Dr. Wolfman, I'll pass it over to you.
Hi, thanks to you in the audience who are taking your lunchtime to be with us. I really appreciate it. And I'd like to thank my co-panel members, Mitch, Louis, Joanna, Dr. Sheriff, Grace, and also Maxine, who couldn't be here today, and Joanne for being here today to help us with this presentation in this important area. So I'm Dr. Wolfman. I'm a professor in the Department of Obstetrics and Gynecology. I'm the director of the Menopause Unit and the Premature Ovarian Insufficiency Clinic. I'm president of the Canadian Menopause Society, and I'm also on the educational committee for the International Menopause Society. And we've just published guidelines in the care of menopausal women for women across Canada, which is published in the Journal of Obstetrics and Gynecology. And I've also just been on the panel for the guidelines for the United States through the North American Menopause Society. A Mature Women's Center has been my dream for over 20 years, but it's been a long road to attract support for aging women. Thankfully, I met Mitch, who shared in my dream. No one wants to think about getting older. However, every woman, if she lives over 50, will become menopausal. Just think of it. Women live 30 to 50% of their lives after menopause now, menopause being the last menstrual period. Globally, there will be 1.2 billion women who are menopausal by 2030, increasing by 47 million women a year. 80% of women will have symptoms related to menopause, and 20% will have severe symptoms. Imagine not being able to function at the level you are functioning now due to debilitating symptoms. It is estimated that $3 billion are lost in revenue due to symptoms of menopause and the absenteeism in the US every year. Why is the time right now for a center? Firstly, the demographic of Canada is aging. we need also a productive workforce that is shrinking. We also, frankly, have a moral obligation to look after and value women of all ages, including women who are past their reproductive lives. We at Mount Sinai are the only Canadian academic center with a fellowship program training the physicians of the future who provide menopausal care. Our vision is to build on our current unit and its satellite programs with the establishment of a world-class institute focused on clinical care, teaching, research, and academic excellence, such as you've seen with Dr. Sheriff, who was one of our graduates. We envisage a center of excellence with clinics for menopause, premature ovarian insufficiency, abnormal uterine bleeding, vulvar diseases, urogynecology, and sexual problems, something that has not been dealt with across our university. Interdisciplinary clinics will provide care for other menopausal issues, including osteoporosis, psychiatry, and breast cancer survivorship. There have been exciting advances in the medical care of women during the menopausal transition since I started on my journey and beyond because of the understanding and the validation of these symptoms of menopause, their physiologic causes and ramifications. When I started in this field, hot flashes were incompletely understood and trivialized. As mammals, we are obligated to control our temperature. Changes occur around menopause because of the decline of ovarian eggs and estrogen. The reduction in estrogen results in inappropriate stimulation of the thermostat area in the brain that results in flashes and sweating to reduce temperature. Other menopausal symptoms have now been validated, and these include mood changes, sleep issues, sexual issues, as well as genital urinary problems. Think of how many years it has taken you to reach your current situation at your firm or your company. Now I present you with a common scenario. Ms. Rising Star, 48-year-old head of accounting at her firm. She has developed hot flashes consisting of nasty sensations of heat and burning rising to her head and neck, causing obvious visual red flushing of her face, which is embarrassing, as well as dripping sweats off her neck. These occur every 2 hours and are worse when she's stressed. They are followed by a chill and rarely a feeling of panic. At night, she experiences these once hourly, awakening her from sleep. In the morning, she's exhausted. She has a shower, then another flash occurs, and she has to go back in the shower, so she's late for work. She has a basket full of natural remedies, all of which make little difference. She is irritable. Her secretary hates her. She can't concentrate. No one likes her at home. And she feels that she really needs to take a leave of absence or she's going to have to quit her job. We also see many of the women that Lindsay described who experience menopause after having their ovaries removed, after chemotherapy for cancer treatments, women with complicated medical situations, women with premature or early menopause, women who are afraid or can't take hormones, or women who have sought alternative care without success. We see women who have lost their desire to have sex, women who can't have sex due to genital changes, and women who have vulvar dryness and burning due to the genital changes that occur after menopause. We see women from all walks of life, from all over Southern Ontario and beyond in multiple scenarios. Our goal in the menopause unit is to allow women to function at the level they have previously functioned at or before these symptoms intruded. Midlife women represent the greatest underappreciated source of innovation and societal support. We support our families, our work, and our country. Please help us to support you. Thank you very much. And I'm going to introduce now Grace Tong. And thank you, Grace, for coming today and to speak to us with a personal story.
Thank you so much, Dr. Wolfman. I'm delighted to be here today as an advocate of women's health to share my personal experiences around perimenopause. I've been a patient of Dr. Wolfman's for several years, and I may cry because I think I did last time, in saying that I can't thank her enough because I feel like she's personally impacted my life. And I am crying. Sorry. Let me just get rid my thoughts for a second. So it's important for me to be a patient advocate today because first, I want to raise awareness so that women know that they're not alone and that there are medical treatments for menopause and perimenopause. And second, and very important to me at this stage of my life, is to help break down barriers and open up dialogue in the workplace. I believe that organizations, if they truly want to uphold the value of inclusion and want to achieve gender equality at the leadership level, which is when women are typically in their 40s and starting to experience these symptoms, that taboos around menopause need to be broken and that more equitable policies and practices need to be in place to support women as we progress through our career. So just a bit about me. A few years ago, I was in my late 40s. I'm now in my early 50s. I started experiencing symptoms of menopause, and I didn't know anything about perimenopause at that time. It started with weight gain, inability to sleep, some occasional hot flashes, and most significantly for me, it was mood changes that really affected my life. I recognized everything was changing, but I didn't know why. I had never really talked about menopause with my mom, never talked about it with my friends, and it just simply wasn't spoken about. So the symptoms got worse over time. And my husband, who's very supportive in this area, did some research, and he told me about the regular practice in the UK in using HRT or hormonal replacement therapy to address perimenopausal symptoms. So my first reaction was, no way. Women have endured this for millennia. There's no way I'm going to do that. It's just a phase. I'll get through this. No big deal. And I think I was ready to kill him when he approached it. It was like, how dare you talk to me about this? You're a man. You have no understanding of this. So that was the first stage. It was denial. It lasted about a year. And during which time I suffered through lack of sleep, mood changes. They got so severe, it affected all aspects of my life, including work, family, my relationship with my daughter, who was very young at the time. And I decided it was time to see my family doctor. But she didn't know much. And her first approach was to prescribe antidepressants to address my mood changes. And so after a couple of weeks on these antidepressants, I realized it wasn't right for what I was going through. So I stopped that. And I didn't go back to my family doctor for a few months later. And then I asked her about HRT. I think at that point in time, I started to recognize, okay, I've got to do something about this. And she in turn admitted she didn't know much about it. But that she said that it was prescribed only for vasomotor symptoms like hot flashes, but it was not prescribed to address mood changes. In the end, she did refer me to Dr. Wolfman's menopause clinic, and then she prescribed HRT, but I knew she wasn't comfortable doing so because she didn't know enough about it. So finally, when I did end up seeing Dr. Wolfman and her team, it was there that I felt they inspired confidence in the treatment. They dispelled misperceptions or misconceptions about the treatment, and they laid fears around potential risks. And they did this in, having that empathetic ear, but also having up-to-date knowledge and research to back up all of this. So I felt a great sense of relief that HRT was safe for me. And so I've been on it for several years now. What was most amazing was that when I first started the HRT, which is a patch for me, after 3 days on the treatment, my mood changed. And I actually thought it was a miracle. I honestly couldn't even believe that my mood changed in 3 days. I was like, I really thought it was, by taking antidepressants, I thought it was me. I thought it was my fault. But when I realized, wow, the hormonal replacement therapy, realized it was actually my life going through a dramatic change hormonally. It was life. It was like just a real aha moment. I couldn't actually believe it. So I think that if I had not received the HRT treatment, I don't think I would have been able to continue in my career. I was actually thinking of stopping at that time because I couldn't manage my responsibilities. I couldn't manage the multitasking of what I had to do in my job. And right now I'm at the height of my career. It's a relatively demanding job with, client expectations, client reports and deliverables. And, ultimately, I don't think I'm that much different than many women or many of you. And I hope that in sharing my experiences, I can help other women who are at the same stage of life. But I also hope to raise awareness among women who are younger. And I try to do that with my younger colleagues as well, because it's about women being together, women being empathetic, and ultimately changing that workplace so that there can be greater gender equality, especially as we move through into leadership. And so I think, just a final thank you to Dr. Wolfman and her clinic for helping me to be able to lead my life more fully at this age, and for helping me to recognize that women have an authentic place as women in the workplace.
Thank you very much, Dr. Wolfman. And thank you, Grace, for your very inspiring story. Grace spoke to one of our town halls, and I can tell you the feedback we received afterwards was huge. So thank you so much for sharing of yourself. It has helped many people already. So thank you. I'd like now to welcome Carol Mitchell. And, we're here today in big part because of Carol's vision and advocacy. And when I joined the organization, I heard her name, but I heard this name, Mitch. And, Mitch is working on this chair. Well, the chair is a reality today. And that is thanks to Carol Mitchell and the chair in Menopause. So, Carol, the floor is yours. And thank you so much for your vision and get us going. Thank you.
Hi. Firstly, a big thank you to Louis for your stalwart support and understanding of our cause. To David Grieco for his unwavering commitment, representation, and friendship in helping us grow our menopause chair. And to Megan O'Hearn for your incredible and tireless effort in having this event come to fruition. Laura, thank you for connecting us up with WCM. Grace, for your incredible bravery, advocacy, and sharing your story with us. Dr. Wolfman and Dr. Sheriff later, thank you for being you. I am Carol Mitchell, known as Mitch. I am the founder and CEO of Imagine Wealth Management, where we manage 2 small hedge funds. I worked on Bay Street for 25 years plus, mostly in institutional equities at Merrill Lynch, Canada. And then in 2006, I moved up from Bay Street to Bloor Street. Menopause. Why does this issue need championing? Firstly, women themselves are uneducated, as for the most part, about what happens after menstruation stops. General practitioners, GPs, do not warn or teach patients that there is a phase after your childbearing years where an extreme drop in estrogen can affect your body and mind badly. GPs themselves are undereducated, which is why Dr. Wendy Wolfman holds an annual conference teaching hundreds of GPs about the latest research results, statistics, and various treatments available, held here in Toronto. Dr. Lindsay Sheriff, her brilliance has resonated in a project that provides GPs a link that they can go to in order to print out a pamphlet for their patients on various gynecological issues. 2, women are in denial because they do not want to be associated with aging. Menopause is filled with stigma and shame. So we need to champion it in order to break the stigma and shame so that many women, the stigma and shame that many women hold and feel. I have often thought about menopause. It is where mental illness was 20 years ago. And I've often said that we are slowly bringing it out of the dark ages. For some of you too young, you may not be aware that menopause was referred to as the change of life. We need to change the change. Thirdly, it takes money to pay researchers to research and develop results, and the medical system is highly skewed toward men and men's health to begin with. If women are filled with shame, then their male counterparts are largely not aware of the devastating effects menopause can have on women. So research has not been traditionally supported by women or men. Fourthly, I know this from fundraising for the chair since I founded it in November of 2015. Apart from extended family, close friends of family, and some grateful to Dr. Wolfman, Dr. Sheriff, Dr. Jacobson patients, it was like pulling teeth to convince women to donate to support the chair. After 5 years of holding educational cocktail party events featuring speeches from Dr. Wolfman, her younger colleagues, Dr. Sheriff, Dr. Jacobson, a patient advocate and highly accomplished business person named Trish Barbado. You can see her on our Sinai Menopause website, which is www.maturewomenshealth.ca. And myself, we realized we had to open these cocktail events up to men. Yes, the spouses who lived with the suffering women. After we did this, we realized that the men who told us so were devastated, as many of them had no idea that so many women suffer at what should be the best years of their lives, both personally and in their careers. They are at the pinnacle of their careers for the most part. This is a quality of life issue for women who struggle, which automatically becomes a family issue. So everyone should be supported. At the mixed event of men and women, the men did help us raise some money and were philanthropic toward our cause. I have several theories about men versus women's philanthropy, but that's a topic for a different time. I will say this. As a woman who still operates a business within capital markets, but on the buy side, I hope that all of you in WCM are successful enough to be able to write big checks to causes that you feel passionately and strongly about. I remember the first $10,000 check I wrote. It felt really, really good and very different from previously donated smaller amounts. And then eventually, writing bigger and bigger checks became addictive. I hope eventually you are all successful enough and are able to become big philanthropists for causes that you are passionate about one day. I digressed. Back to why championing, that's a hard word to say, menopause. The irony here, women work very hard at keeping young and sexy. We all want to be young and sexy forever. A little HRT, if it is the right prescription for the individual, can actually help the situation. Grace just told you that. Not to mention, help postmenopausal women avoid heart and bone issues. In fact, right now, due to COVID and supply side constraints, there is a huge shortage of HRT drugs in the UK. A recent news article had women who rely on hormone replacement therapy petitioning, holding signs saying that if this were Viagra, a man's issue, the men would have called in the army by now. I see you're laughing, Louis. Okay, while this audience is on balance younger, and most of you are still in your childbearing years and cannot possibly fathom losing your period and having hot flashes and sweats and severe depression and headaches and sleeplessness, I totally get that. Your current issues revolve around dating, spouses, your kids and families, childcare, nanny issues, inequities at the office, etc., while you are working on Bay Street. That is tough enough. If you do not wish to see into the future and what it could have in store for you, I honestly cannot blame you. So please just think about your mom or somebody else's mom who you noticed has had a hard time with the transition into middle age. You can tell who has had sleepless nights and irritability written all over them. It is not a pretty picture. Please know that my point is that this is totally avoidable and that we are working hard to dispel the myths associated with menopause and that there is help and treatment available for everyone. It's not always HRT, but there are healthy alternatives. My dream when this all began was for the chair to eventually lead to a Sinai Menopause Center. We are currently working at making that dream a reality. Thank you.
Thank you very much, Mitch. Thank you so much. And thank you to all our speakers today. We're very appreciative of you sharing your perspective and expertise as well. So thank you. We're now going to move into the Q&A portion of our program. We received quite a number of questions, so I have a list of questions that I'll go through. But if you have any additional questions, please put them in the chat box below the screen, and Megan is going to text them to me, so we'll be able to try to cover as many as possible. And we're going to kick things off with Lara, that actually is going to ask a question, I believe, of Dr. Sheriff. Lara, the floor is yours.
Thank you, Louis. Dr. Sheriff, how would you suggest women of all ages advocate better for their health?
So I think it's really important to take time to focus on yourself and your symptoms. As I kind of talked briefly about in my introduction, we play all these roles, or we wear all these hats, and it's important sometimes not to focus on other people, to focus on the symptoms that you're experiencing, and never be afraid to call your doctor. Never think a symptom is too minor or too normal to seek assistance for, because we see lots of people in the women's unit in the menopause clinic where, it took them forever to get here with abnormal uterine bleeding. And it would have been very easy to see them a little bit earlier and to diagnose and to treat their condition much earlier than when they presented. So I think the biggest piece is to never undermine or dismiss symptoms you have, because there's care for you.
Thank you very much, Lara, and thank you, Dr. Sheriff. The next question is for Dr. Wolfman. Can you talk about sleep issues in menopausal and postmenopausal women?
Well, sleep is tremendously important. If you can't sleep, you can't work, and your mood is affected, and you may also develop joint pains. So there has been, in the last 20 years, a lot of research to see whether sleep is actually a menopausal situation. And for many women who previously were good sleepers, it is. So up to almost 46% of women between the ages of 48 and 64 have sleep issues. There are many other causes of sleep issues. So, for instance, sleep apnea, restless leg syndrome, etc. So not all sleep issues are related to menopause. And for women who have always had sleep problems, it may be a different etiology. But in women who previously were good sleepers, and then even starting up to 2 years before menopause start to have sleep problems, it may be related to menopause. One related to the vasomotor symptoms are hot flashes that can disrupt sleep. But there may be an independent effect of the lack of estrogen on the brain. We always start with sleep hygiene. So, for instance, no coffee after probably in the afternoon, regular exercise, but not too close to when you're going to sleep. Make sure your room is dark, no screen time or multitasking before you go to bed. Try and void before you go to bed, a cool room, and do this every single night. And then there are some aids, such as they're like CBT types of relaxing aids to calm you down right before you go to sleep. So these are some of the things we do. There is a little bit of data on some other agents that can help sleep. But if it doesn't work, then sometimes we will try a course of hormone therapy. And remember, you don't have to take a whole year of hormone therapy. We can give it to you if you have no contraindications for a few months, see if your sleep improves. If it doesn't, we look for something else. Sleep, really important, a problem that many, many women have and often gets worse around menopause and now has become a validated menopausal symptom.
Thank you, Dr. Wolfman. Our next question will be directed to Mitch is how can we gain attention around menopause from those who are not at that stage of their life or will never experience menopause?
That's a really tough question. I think everybody experiences it, but some of us less so symptom-wise than others. But that is if we live long enough. But I think we just have to keep talking about it. You know, Louis, at the beginning when we started the chair, I called it the chair in mature women's health. I couldn't even say the word menopause. The word would not come out of my mouth. And then as time went on and I realized how shame-filled and stigma-filled this whole silo, this whole area was, I said, you know, we have to change this. And I think you were on the Zoom call where we changed the name of the chair to the chair in menopause because we want to hit it. We want to be hard-hitting and get the word out there. It's happening. It's happening everywhere. Especially in the UK. You've got Princess Eugenie talking about it and on no uncertain terms, very, very directly, almost as detailed as Dr. Wolfman, but not quite. And so just spreading the message and talking about it, not being afraid to talk about it is key. I mean, it's a life stage. We have so many stages. We're born, and then there's a whole continuum until we die, and it's part of the continuum, and it needs to get equal notoriety. I mean, it needs to be noted for all intents and purposes to everyone.
Thank you. The next question, Grace, you spoke about the workplace and even your own thinking around should you stay in your job or not, but the question is the following. What role does the workplace have to educate, destigmatize, and offer support around healthcare issues?
Got to go off mute. Well, I think as I mentioned, I think it's critical because women are at that age when they are entering the height of their careers. They're generally entering senior level management roles. Unfortunately, sometimes it coincides with those menopause symptoms. So if we don't talk about it and we continue to hide in shame, it creates challenges in terms of productivity, working relationships as well, and ultimately retention, which is huge for workplaces now. Is if you want people, I just did a recent study. So I work in social research. I just did a recent study where only 30% of the senior leadership are women. And we know that we've been trying to reduce that inequality for decades. But why is it still 30% and not 50%, which would be representative of the general population? So in order to keep women, I think it's really important. And I think Mitch had mentioned earlier about the UK making strides in this area. So our company is a global company, and our colleagues in the UK, they've just implemented something in the last year around menopause. They call it the menopause policy, but they've also created other policies too around fertility treatment, period policy. So it's recognizing women's health and how it can affect the workplace or productivity within the workplace. But it can be just simply raising awareness, that's the most basic, but then implementing policies around, adjusting workplace environments, flexible working arrangements, which I think during COVID has really come to light, educating managers about the experiences of women who may be going through it, employer support groups, paid leave, a whole number of policies that could be implemented that could normalize how women are experiencing this.
Thank you very much, Grace. Next question for Dr. Sharif. It's what do you know about perimenopause and what are the best resources to support this? Sorry, what do we know? I know you know a lot about it, but what do we know? And what is the lifestyle adjustments and everything else?
Yeah, so perimenopause is this transition from the reproductive age to menopause, and it involves fluctuation of hormones, most notably estrogen. And physiologically, when we think about it, the ovaries become less responsive to a hormone called FSH, and that comes from the brain, and the brain goes into overdrive, and the ovaries kind of shut down, and they don't make as much estrogen, and FSH goes way up, but sometimes the ovaries are a little bit more responsive and will make estrogen. And so what perimenopause is this fluctuation of hormones where women get all the kind of bothersome symptoms, or can get many of the bothersome symptoms of menopause: hot flushes, night sweats, poor sleep, change in cognition, change in mood, vaginal dryness. But then we're also kind of saddled with the fluctuation in estrogen and what it does to the uterine lining. So we tend to get these really long periods, perhaps periods that are much closer together, abnormal uterine bleeding. And I think the biggest thing, if you're going through perimenopause, that is to call your doctor, because sometimes these bleeding concerns certainly need addressing. You may need an endometrial biopsy. You may need imaging. And then also recognizing the symptoms that come along with perimenopause related to menopause. There is treatment for those symptoms, and you want to call your doctor, because many of the treatments are what we would offer patients who are completely menopausal, that is, no period for 1 year or longer. And we just maybe change how we prescribe them, because you may still be getting a period in your perimenopausal time. So I think the biggest thing is to call your doctor, make sure that you don't miss any worrisome symptoms of perimenopause, and then come and see us in the Women's Unit. We're happy to guide you through this time.
Thank you very much. We did get a question that just came in from the audience, and I'd like to ask that one. I'm going to skip a few others just because there's been so much talk about HRT, and I think it's for you, Dr. Wolfman, this one. So the question is, how long can a woman continue taking HRT? What's sort of your answer to that question?
Right. So I think that there used to be this idea that you could only take hormone therapy for 5 years. And that was based on really the gold standard study called the Women's Health Initiative that was published in 2002 and was prematurely actually stopped because these health risks were exceeded. And for women who had a uterus, who took both estrogen, a certain type of estrogen, and progestin, there was a ratio exceeded for the risk of heart disease and breast cancer. Women who took estrogen alone, the study carried on for 7 years because there was a teeny tiny excess risk of stroke. We now have 18 to 20 years after the WHI. And we have looked at all the ultimate health risks for those women who took hormone therapy for about 5.8 years and 7 years in the two different trials. And let's start with the women who were between the ages of 50 to 59 and took estrogen alone. They really had wonderful outcomes 20 years later. They had less heart disease and death from heart disease, less death from Alzheimer's disease, and less breast cancer. So they had 20% less breast cancer that persisted after they took a relatively short course of hormone therapy. For the women who took continuous combined hormone therapy, there was really no significant increased health risk except for a very slight increased risk of breast cancer, but no more death for breast cancer and actually less cardiovascular death. So because of those evaluations now that we can look in perspective, we really do not have an ultimate length of time that women can take hormone therapy. And all the major organizations recommend that hormone therapy is an individual prescription based on the person's symptoms, their risk factors, that is, if they don't develop any absolute risk factors, counseling every patient with respect to their risks and benefits of taking the hormone therapy, and looking at the indications and why the patient is taking it, and looking at the form of therapy to try and reduce any small risks that might occur, and to discuss, actually, frankly, the benefits. We currently primarily prescribe hormone therapy to relieve the symptoms of menopause. We don't prescribe it currently to prevent diseases of aging. And that big study that was done wasn't looking at whether taking hormone therapy prevented the symptoms, because we knew that it treated them in 75 to 90% of the cases. It was a study to look at whether taking hormone therapy in women prevented diseases of aging, such as osteoporosis, heart disease, clots in the legs, clots in the lungs, breast cancer, colon cancer, and what we called a global index that combined everything. So we actually think that this is very safe therapy and can be prescribed for quite a long period of time. What we don't have and we need are these women who are so-called long-term users, marathon users, who take hormone therapy for, let's say, 20 years. We have many patients in our practice who do. There is not as much data on that group of people.
Thank you very much, Dr. Wolfman. Maybe one last question before I have a question for all the panelists. And this one to you, Dr. Sheriff, is around how do symptoms and experiences differ across different backgrounds?
Yeah, so we know that there have been a number of studies suggesting that ethnic background influences one's perception and experience of menopause symptoms. For example, the biggest study is called the SWAN study, the study of women's health across the nation. It's a 7-site study that looked at ethnic differences of symptoms. What we know from the SWAN study is that Black, Asian, and Hispanic women, on average, begin their menopause earlier than white women. We also know that Black women have a longer transition, perhaps a longer perimenopause, perhaps worse symptoms than women who are Caucasian. And we have to be very mindful of the fact that these symptoms can differ across different backgrounds, because it's important that we share this with our patients, and we do this in the clinic. And it's also very important in the research that goes on at our hospital, because it's very important that we aim to include all groups of women in our studies, and we do sub-analyses. Because ethnicity does play a role in menopause, and we know that. So hopefully that answers your question, but that's what I have to say.
Thank you so much. And it's now time to sort of ask each one of our panelists the following question. If there is one takeaway you would want the audience to leave with today, what is that takeaway? So Grace, you're going to kick things off if that's okay.
Sure. Yes. I think the one thing is to be open and not be afraid to speak out. I think wherever I can find a voice within my workplace, I do. So we know diversity, equity, and inclusion is on everyone's agenda these days. So I recently joined our Belong Committee, which has access to the Canadian leadership team. So I brought it up there. I brought it up with my manager. I bring it up with my younger colleagues. I simply just talk about it as much as I can.
Thank you so much. Mitch.
Unmute here. Again, getting the message out and trying to dispel all the draconian myths associated with this rite of passage. And we should, middle-aged women should still feel young and good and enjoy their children and their grandchildren in good health. They should feel the same way they did before menopause, and it is achievable. It's actually not difficult. So we have to talk about it, and we have to be mindful, and we have to get our collective spouses and families on board with the entire menopause thing.
Thank you, Mitch. Dr. Sheriff.
I think the biggest thing, if I could, my last message, I guess, would just be to advocate for yourself. Do not dismiss your symptoms. Your symptoms matter. We are here to help. And then also to really reiterate the importance of knowledge translation strategies from the research that goes on at our center. Be open to participating in research studies, because this is what advances what we know about women and women's health and improves the quality of care that we can provide you with.
Thank you very much. And Dr. Wolfman, what is that takeaway you'd like our audience to leave with?
Well, I think we didn't touch upon something that happened in the last 10 years, which for me really validated all this. And that is that the cells that are responsible for the symptoms have been discovered. And we know the area in the brain now that's responsible for hot flashes and thermal regulation. And while this has been sort of nebulous, and maybe some people thought emotional and social and psychiatric, for me personally, when there was actually an anatomical discovery and the physiology of why this happens was discovered, and this is leading to a rundown of a lot of the explanations about the symptoms of menopause. Why are they happening? Weight gain at menopause, this is being discovered. And so help us to do this research that needs to be done and hasn't been done and has really been ignored. What we're proposing is a clinical system for areas that are not being addressed adequately for women. The wait times for our clinics, the demands on our care, things like vulvar disease, 2-year waiting lists. No one's addressing sexuality. We have rights as women, and we need to improve our quality of a life and our ability to keep doing what we do so well. And by establishing this clinic, which will be world-renowned and an example for other places in the world, you will be helping us advance medical care globally, not just locally. So I thank you again, and I thank the foundation, and also Gary Newton for supporting us, and David Grieco, and Matt Surmer, who have gotten on board to listen to us and help us after 20 years to try and achieve this goal, because the time is now. Thank you very much.
Thank you very much, Dr. Wolfman, and thank you to all of you for being with us today. You know, this is about health equity. It really is, and societal, inequity that we face. We need to address this. And certainly Sinai Health is addressing it. I think we have here not only an opportunity, but certainly an obligation to do that. And so we're very honored to be part of this as an organization, because it is still underserved and certainly stigmatized. And hopefully today we start to bring this a little more to light. But one of the things we want to do is integrating these multiple disciplines, as Dr. Wolfman has mentioned, under one roof, where we'll be able to educate our community, train the next generation, because we need to do that as well, of clinical and research leaders, and advance knowledge in the field. And this will provide world-leading evidence-based care to meet the growing need of our patients. Because as Dr. Wolfman mentioned, there is a waiting list. So we need to increase the capacity in the system as well. So to turn this vision into a reality, I'm really excited about this. And we are very excited as an organization. Sinai Health Foundation is launching a huge effort to fundraise for the Center for Mature Women's Health. We have a very bold vision. Dr. Wolfman sort of didn't put any restraints on it. It's a very large vision. So we said we're going to go by a phase-in approach. And the phase one of this, which is a critical piece, is really to raise $15 million to launch this center. It is anchored on the chair of menopause, the menopause chair, the Carol Mitchell chair that Carol and Mitch was so instrumental in leading the way. So that becomes really the anchor. So we have a great place to start from, but there's a lot of work ahead of us. And together with our experts and generous donor community, we will address this massive gap if we all pitch in together and work together. So what am I asking you today is we want you to be part of the conversation. And so you're going to get the recordings of this event, and the fundraising team or the philanthropy team will reach out to you to have a conversation, because you can help in many ways. Certainly, hopefully by being a great ambassador. This is super important. Secondly, hopefully you can give. But if you can give yourself, you can maybe open your networks. You can actually organize events. The more we get the word out, the better it is for all of us. We're all in this thing together. And so with this, I really want to thank each and every one of you. Thank you to our panelists. Lara, thank you so much to you and WCM. This is wonderful, this partnership, and looking forward for more opportunities to collaborate. And thank you to all of you for participating today. So with that, I wish each and every one of you a great afternoon. We will close with a video, which is around women's health, and the video's title is actually Missing Pieces. So thank you very much, everyone, and have a wonderful afternoon.
When it comes to women's health, we're missing pieces, blanks yet to be filled, answers yet to be found. Here at Sinai Health, we're changing all that. With world-class expertise and a research-first approach, we're creating more answers around fertility, complex pregnancies, and changing the way we perceive menopause and treat endometriosis. Every day, we're adding more pieces to the puzzle, and we won't stop until it's complete.